Welcome to this deep dive. Today we're going to be tackling a question that I'm sure has crossed the minds of many dachshund owners out there. Does neutering affect how severe intervertebral disc disease can get?
It's a really important question, particularly because, dachshunds are so prone to IVDE.
For sure. And to really get to the bottom of this, we're going to be diving into a 2024 study from the Journal of Small Animal Practice.
Oh, cool.
It focuses on female dachshunds who have confirmed thoracolumbar IVDE. And that's the kind that affects their mid and lower backs.
Yeah.
The area most commonly affected in dachshunds.
Yeah, this study is actually adding a new layer to our understanding of IVDE. Because, IVD is such a big deal for dachshunds because of their unique anatomy and their intervertebral discs, which are like the cushions between the vertebrae. They tend to degenerate really early on in dachshunds.
Yeah.
And that means that the center of the disc, which is usually gel-like, can actually harden and even rupture. And that puts pressure on the spinal cord.
I can only imagine how painful that must be.
Yeah. It can range from, mild discomfort to even paralysis. It really just depends on how severe it is.
Wow.
And that's really what this study is focused on, is neutering impacting the severity of IVDE.
Right, because we've kind of gone back and forth whether neutering increases the risk of IVDE in the first place.
Exactly. Some studies have shown there might be a link, especially when dogs are neutered early.
Oh.
Possibly because of hormones and their role in how the skeleton develops. But this study wanted to see if neutering impacts how bad the IVDE is, not just if a dog gets it or not.
So not just if they have it, but how severe it is.
Precisely. And they looked at things like, the dog's neurological status when they first presented to the hospital, using the modified Frankel score, which is a way to kind of grade a dog's mobility.
Gotcha.
They also measured things like, how long the piece of extruded disc material was and how much the spinal cord was compressed.
Oh, wow.
All to get a very detailed picture of the severity.
So they really wanted to get granular.
Yes, absolutely. And for this study, they looked at a group of 154 female dachshunds who had already been diagnosed with thoracolumbar IVDE and had surgery.
Okay, so all these dogs definitely had IVDE.
Yes, so they were comparing like for like.
Exactly.
Then they divided these dogs into 3 groups based on when they were neutered. So those neutered before 12 months, those neutered at or after 12 months, and then intact dogs.
So they wanted to see if there were any patterns between when the dog was neutered and how bad their IVDE was.
That's right, and what they found was pretty surprising.
Oh, really? Tell me more.
Despite looking at the severity of IVDE, they actually didn't find any significant differences between those 3 groups in any of the things they measured.
Oh, wow. So it didn't seem to matter when they were neutered or if they were neutered at all.
At least in this study, that seemed to be the case. And this is a pretty significant finding, given all the concerns about neutering and IVDE.
Yeah, it really flips the script. It challenges everything we thought we knew.
Yeah.
But like any study, I'm sure there were some limitations.
Of course. And the authors actually did a really good job of being upfront about those limitations.
Okay.
For example, they acknowledged that their sample size, while decent for this kind of study, it was still on the smaller side.
Right, 154 female dogs.
Yeah. And all of those dogs were from only 2 referral hospitals.
Oh, okay.
So, while the findings are valuable, we can't necessarily say that this applies to all dachshunds everywhere.
So what does this all mean for our listeners who maybe own dachshunds or are thinking about getting one?
That is the burning question, isn't it?
It is. We'll have to unpack that a little bit later.
Yeah, it really is a big question.
Right, you mentioned sample size, and they only looked at female dachshunds from 2 specific hospitals. Were there any other limitations?
Yeah. They also highlighted that this was a retrospective study, meaning they were kind of looking back at medical records that had already been collected.
So they weren't like controlling the variables or anything.
Right.
Exactly. And that comes with its own limitations. So, for example, the modified Frankel score, which they used to look at like how bad the neurological problems were, was based on notes from different vets at different times.
Okay. So there could be some inconsistencies there.
Exactly. Like one vet might describe a dog's, walking ability a little differently than another vet.
Gotcha.
And they also didn't have a control group of dachshunds without IVDE to compare to.
Oh, right. That would have been helpful.
Yeah, to see if like the differences between those neutered and intact groups were actually meaningful. And, there were also some limitations with the imaging analysis.
Okay.
They used CT and MRI scans to measure things like how much disc material was pushing out.
And those are different types of imaging, right?
CT scans are better for looking at bone, and MRI is better for soft tissues.
Gotcha.
So, using both introduces some variability in the measurement.
Right, like comparing a ruler to a measuring tape. Yeah. Exactly. And they also mentioned that it's sometimes hard to tell the difference between extruded disc material and blood on those scans.
Oh, wow.
Which could have affected their measurements of, how much disc material was actually pressing on the spinal cord.
So there's a little bit of room for interpretation there.
There is. And then finally, their follow-up information was limited.
Yeah.
They were mainly looking at the dogs who needed a second surgery for IVDE.
So they might have missed some dogs that maybe didn't need surgery.
Exactly. And those dogs might have, had different things going on that could have changed the results of this study.
It sounds like they're really aware of the limitations.
Yeah, they did a good job of being upfront about that and not overstating their findings.
Absolutely.
Yeah.
Which is always a good sign. But even with all of that, it's still interesting, isn't it? It's not every day that a study comes out that challenges what we thought we knew.
Right. It definitely opens up new ways of thinking about IVDE and how we manage it in these dogs.
So where do we go from here? What's this mean for dachshund owners?
That's the crux of the matter. I think the most important thing is that this study is really reassuring for owners who have neutered their dachshunds or are thinking about doing it.
Okay.
They don't have to worry as much about neutering making IVDE worse if it happens.
Right.
But we still have to remember that neutering is still considered a risk factor for getting IVDE in the first place.
So it's still a decision they need to make with their vet.
Exactly.
Right.
Considering their dog's overall health and lifestyle.
Right. Weighing the benefits and risks.
Absolutely. And I think the good news is that this study suggests if a dachshund does end up with IVDE, it doesn't mean they're going to automatically have a bad outcome.
Right. It's not so black and white.
No, not at all. And, it really emphasizes the importance of more research.
Oh, absolutely.
We still have a lot to learn about IVDE and neutering.
We do. But there's some things dachshund owners can do right now to help prevent IVDE.
Oh, yeah.
Like what?
Yeah.
Give us the tips.
Well, the biggest one is keeping your dachshund at a healthy weight.
Yeah. I've seen some chunky dachshunds out there.
Yeah. Being overweight puts a lot of stress on their spine.
Makes sense.
And that can really increase the risk of IVDE.
So portion control and exercise are key.
Absolutely.
Yeah.
And when it comes to exercise, you want to find a balance.
Yeah.
Regular activity is important to keep their muscles strong, but you also want to avoid things that put too much stress on their backs.
Like jumping off furniture.
Exactly. Things like that. Gentle walks, playtime in the yard, even swimming are all good options.
Yeah.
And giving them a supportive bed, like an orthopedic bed, can help keep their spine aligned.
It's about thinking about their backs all the time.
Yeah. And of course, regular vet checkups are important too.
Of course.
Your vet can check their spine, look for any early signs of IVDE, and, step in early if needed.
Early detection is key.
Yes, it is. The sooner IVDE is addressed, the better the chances of a good recovery.
So to kind of wrap up, we've talked about the study, its limitations, and some tips for owners. What's the main message for our listeners today?
Well, I think the main takeaway is that this study gives us some really valuable information about neutering and IVDE in female dachshunds. But it's really just one piece of the puzzle.
There's still a lot to learn.
There is. But, armed with this information and a good relationship with their vet, dachshund owners can make the best choices for their pups to help them live long, happy, and healthy lives.
That's a great point. And on that note, I think that brings us to the end of our deep dive.
It feels like every new study we get is adding to our understanding of this whole neutering and IVDE thing.
Yeah, for sure. But it's almost like each study adds a piece to the puzzle. But we still don't have the whole picture.
Right. And, one of those missing pieces might be genetics.
Okay. So it's not just about, neutering or their weight.
Right.
A dog's genes might actually play a role, too.
Absolutely. Dachshunds are prone to IVDE because of their body shape and how their discs degenerate.
Yeah.
But even within that breed, there could be genes that make some dogs more likely to have problems than others.
So even two dachshunds from the same litter could have different risks.
Exactly. And this is where, more research would be really helpful.
Yeah.
Like, imagine if we had genetic tests to tell us which dachshunds are at higher risk.
That would be amazing.
Right? Owners could be more careful about their weight and what kind of exercise they do. And breeders could make better choices about which dogs to breed from.
To maybe prevent IVDE in future puppies.
Exactly. It's like we're moving towards a more personalized approach to IVDE prevention.
Yeah. Taking into account all these different factors.
Yeah, like their genes, their lifestyle, everything. That's really exciting for veterinary medicine.
Yeah. Moving away from those one-size-fits-all recommendations, it seems like we're close to some big breakthroughs in how we think about and manage IVDE.
I think so, too.
Yeah.
And, those breakthroughs will come from research communication between vets and owners and being open to new ideas.
So for our listeners today, even though this study gives us some good news about neutering and IVDE severity, it's really just the start of a bigger conversation.
Yeah, we still have so much to learn. But with every new discovery, we're getting closer to a future where IVDE isn't such a big problem for our dachshunds.
And in the meantime, we can all stay informed, talk to our vets, and make good choices to keep our dogs healthy.
I agree with all of that.
All right, well, I think that about wraps up this deep dive.
From Vet Neurojar, keep those minds inspired, hearts light, and tails wagging.